Hello everyone, so we are going to dig into chapter 1, which is the introduction to psychological assessments. So first, it's important to define what assessment is in the first place. And so this is something that we might hear quite a bit, but don't necessarily define in the terms of how it's used in counseling practice. And assessment might feel like one of those things that you may not use very much, or you may not want to use very much, or you might be tempted to have a thought like, I don't want to be a psychologist. I am not interested in doing a bunch of testing. That's not what I want to do with my career, and that's not how I want to connect with my clients. However, assessment is something that we actually use quite a lot as counselors. And you actually have started to use assessment a little bit already in the program. So when we learned about diagnosis and intake interviews and started to talk about things like treatment planning, we were using assessment strategies in order to do differential diagnosis and case conceptualization. So there are elements of assessment that are really a part of the essential pieces of what counselors do in their practice. And then we're going to learn about some of the instruments and more concrete procedures that can go along with that assessment process. And so when we talk about assessment, we talk about assessment being a process because it's an ongoing exploration of what's going on with the client. It's not a one-time, it's not a single test, it's not a single instrument or standardized assessment that we might use to take one snapshot of somebody's life at one point in time. Assessment really is an ongoing process that's systematic and holistic. And so it's an idea of what is the best way to gather information about this client, about what's going on with this client, so that I can capture as much information as possible about what's going on, and then I can use that to inform treatment and connect that individual with resources. So we talked in diagnosis class about how a diagnosis can unlock resources for a client. Assessment is the same sort of idea. So if we're appropriately using assessment for a client, it can be really helpful because it can help the client gain more information about themselves. It can help someone gain more information about, for example, their child or their partner. It can help with us getting a better picture of the kinds of supports that that individual might need, or the kind of treatment interventions that might be helpful for that person, or the level of intervention. So in your addictions course, you talked about assessing for substance use levels, and so doing things like ASIs. And so all of those assessments are means of figuring out what kinds of things a client needs so that we can help try to get them the most appropriate supports and interventions as possible. And so the assessment process is ongoing in nature and usually includes more than one way to collect information. So it might include an intake interview, it might include a questionnaire they have to fill out, it might include some amount of testing, but it might also include things like treatment planning and checking in about how they're doing with reaching their goals, and checking in about outcomes for treatments and those kinds of things too. And so we're using some combination of testing and interviews and observations and input from the client so that not only we can get a good picture of what's going on, but the client can get a good picture of what's going on, which can be really validating and insightful for them too. So in talking about assessment, one piece of that is testing. And so testing might be using certain instruments to measure certain types of things depending on what information we need, what's going on. So testing is really this process of administering some kind of instrument and then interpreting the outcome of that instrument for the client. And so sometimes we do assessments without any kind of testing involved, but testing can be a part of that picture. So in all of this process, there are really two people involved. There are the assessors. So that would be, in this case, the counselor. So they're acting as examiner or professional, someone who's trained in these assessment strategies and knows how to use them in a way that's ethical, culturally competent, and within their scope of practice that's covered by their licensure. And then there's the client or the person who's being assessed, and they provide the information, but at the end, it's important for them to also know the outcomes of those, and we'll get into that more in the ethics chapter as well. So why would a counselor use psychological assessment? So we might use this as a screening tool. So we have intake interviews, we have questionnaires that usually a client fills out that includes, for example, check boxes of things that they might be concerned about. We might also use certain screening tools to see if they meet any kind of diagnoses. So that kind of connects with the screening idea too. But just sort of seeing if also a client qualifies for the type of treatment that you offer in the place that you are working. Because some places are specialized and only offer services for certain types of diagnoses. I know in a community clinic where I used to practice, we would only serve clients with what's called SPMI, or severe and persistent mental illness. And so we had to screen clients' symptoms and make sure that they met the criteria for the types of diagnoses that we were able to serve, and the treatment that we offered was appropriate for them. And if not, we would have to refer them. And so we would use it as a screening tool for a lot of different things. Diagnosis, so we've talked a little bit about this in diagnosis class, but you would use assessment for differential diagnosis, and there might be certain instruments that you would use that are screeners for certain types of mental illness that we'll learn about in this class. So I think about a client that I've had fairly recently, and that client had been diagnosed with bipolar disorder pretty early on in her life, and she was now in emerging adulthood, about early college age. And she just said, I've always been told I have bipolar disorder, but I just don't feel like it fits my life anymore. I was diagnosed at a time I was using drugs, and I had a lot of things going on, and I just feel a lot more stable now, and it hasn't been an issue in a couple of years. And so I used an Achenbach assessment with her, which is an assessment that's a screener tool for different kinds of mental health diagnoses. And so she's like, I said, I can just kind of go through the diagnostic criteria with you, but she felt like that just wasn't enough to know that it wasn't a part of her life anymore. She needed some sort of reassurance. And so her taking that standardized assessment, and then the outcome of that assessment was that she wasn't in the clinical area for any kind of diagnosis beyond the anxiety that we had already identified for her. Well, you could just see this big sigh of relief and this feeling wash over her, saying, this test on this piece of paper that doesn't know me from anyone else says that it doesn't look like I have bipolar disorder anymore. And of course, I talked to her about, we probably need to monitor and make sure those symptoms don't come back for you. But at this point in your life, from what you're telling me, from the interview that I've had with you, us talking through the symptoms, and now you taking this clinical assessment, that doesn't seem to be a part of the picture for you anymore, was a huge relief for her. And it really changed the way that she defined her life at that point. So using those kinds of clinical screening tools like testing, like interviews for the purpose of diagnosis can help with labeling someone with a diagnosis, but can also help with ruling things out. Then for interventions and treatment planning, if we are using assessments in the way of observations, in the way of interviews, in the way of testing, to again get a better and clearer picture of what's going on for a client, then that helps us with identifying interventions, specific programming, specific treatments that would be ideal for those kinds of things. And so, for example, with like EMDR treatment, even that protocol has some assessment in the beginning to take some background information and make sure that there's specific trauma that we can target for them to work on EMDR treatment. Otherwise, it's not going to be very helpful. So those kinds of things can help with being able to know what kinds of treatments and interventions are going to be appropriate for a client. Then evaluation of progress and outcomes. So we might, for example, use something like a depression inventory at the beginning of treatment, and then take it 6 weeks later again and see if there's been a change in the level of symptoms that we have, so we can evaluate how well treatment is working for a client. And then informing treatment options, and as we've talked about before, unlocking resources. And so, for example, using something like an ASI to determine what level of treatment somebody would need, and that would help connect them with appropriate resources or appropriate treatment interventions or professionals who can help them. So again, when we talk about assessment, you might go straight to the idea of testing and maybe standardized testing in schools or maybe use of testing instruments with clients. But assessment can include testing, which are these kind of standardized instruments that we would use, interviews, which can be structured or semi-structured or completely unstructured interviews that you have with a client where you're just talking about things with them and discover new information, and then observations. So if there are some more standardized rating scales that you might use that are based on clinical observations. Again, thinking about some of the diagnostic criteria we might observe in a client, but they may not be able to describe for us. Things like taking case notes or making observations, and we'll learn about that a little bit in your skills courses. So taking observations as a clinician, noticing things about the client, keeping records of things, all of that falls under observations. And so where we get information as clinicians is, of course, the client. So we're having interviews, we're talking with the client, we're learning more about them as they share. But there's also what's called collateral. And so there's always multiple sources of information to learn more about a complete and holistic picture of what's going on for a client. And so there might be personal sources to think about working with children and talking with caregivers, talking with parents in a school setting, talking with teachers, talking with other support professionals they work with. So understanding both personal and professional sources who have a better picture of what's going on or can maybe give a different view of a picture of what's going on for a client. So talking with spouses, partners, family members, getting releases of information to talk to primary care physicians. So wanting to make sure that there's nothing biologically going on. I've gotten releases of information to get to talk to psychiatric nurse practitioners if my clients are on any kind of psychiatric medication. That way I can use those professional sources to understand if, for example, a new symptom has shown up. Is that truly a new symptom, or is it a side effect of a medication that's been adjusted? So I have to use those collateral professional sources to make sure I've got a full picture of what's going on to make that assessment. And then there's records, all kinds of records. So you might get educational records, you might get records from previous clinicians they've worked with, previous medical professionals they've worked with. I think about, so when I do ASIs at my practice, I get collateral in the form of like court reports or copies of police reports that go along with clients who've been mandated, those kinds of things. If you're working with like Department of Family Services, there's all kinds of records and collateral that they would give you in working with a family so you can understand the background. So some of those records will be readily available to you depending on the setting that you're in, and some of them you might have to seek out and ask for depending on what it seems like you need to get a better picture of what's going on for a client. And so in the process of assessment, we start by first identifying the problem to be addressed. So we'll talk about this more in the ethics chapter. But ethically, we can't just do a battery of assessments just because. We have to identify some sort of problem, some sort of information we need to gain, and make sure that's directly connected into what the client wants, the client's goals, what the client needs, because the client has that autonomy piece, right? So they have to consent to all of this, they have to understand why it's all happening, and the assessment process that we use has to clearly connect with the problem that's identified by the client. Then, given that problem, we have to select and implement appropriate methods of assessment. And remember, again, that might be certain interviews that we might need to have, certain observations we might need to make, and then it could include some sort of instrument or testing that we would need to do. So once we've done all of that assessment, we have to evaluate that information and evaluate it ideally holistically. So score the assessments, look over the interview information, But then think about it all together. So what does all of this together mean for the client? When we combine the interviews, the tests, and the observations that we've used, what does all that mean for the client? And then it's really important to generate results and recommendations that we share with the client so that they fully understand the outcome of all of that assessment and what it means in real terms. And again, we'll get into this more in the ethics chapter. So looking at the history specifically of testing, so looking at those instruments that we would use, clearly the mathematics has been around for a really long time. The statistics have been around for a really long time. Some of the earliest testing that we saw were different means of intelligence testing that were developed in the early 1900s. We saw some evolutions of creating testing. We saw this movement of creating testing around the needs of the military. And so, for example, some of the earliest career assessments and career theories came out of veterans who came home from war and then didn't have anything else to do. So they came home and then weren't really sure how to transition back into everyday life, into finding jobs. And so there was this movement of developing a lot of testing to help with those veterans identifying different career paths, matching up with new roles, new jobs, and those kinds of things as they transitioned back from World War II. And so we would see development of different kinds of testing as different societal shifts created opportunities for use of those kinds of testing. And so a lot of the tests that we'll learn about first were developed prior to 1970 and then now have more recent iterations that have existed. So some of these assessments have been around quite a long time that are still used today. For example, the Stanford Binet Intelligence Scale was developed like prior to 1920, and it's still something that's around. It's still something that's used. There's of course a more updated version of it, but the origins are still there from the early learning. Bloom's taxonomy of education is still used in modern higher education systems, and that was developed in the 50s. So a lot of these things have been around and really stood the test of time and have just been updated, adapted, and that becomes relevant particularly when we start talking about cultural competency, which comes in a later chapter, and thinking about the context of when a lot of these assessments were developed. So there has been some evolution, but then also the roots of those are from very interesting times in terms of Western societal development over the last 100 years or so, or 120 years or so, I guess, because it's 2020 now. So there's also been a lot of evolution in different elements of law, in the way that we view ethics, and then also in the way that counselors orient themselves to the client. And so think about, as some of these tests and assessments were developed, it was really the job of the psychologist, of the counselor, to be the expert. You know, I'm the one who tests you, I assess you, and then I interpret for you. And so that really is not how we conceptualize counselors anymore. We really talk about being holistic. We really talk about being on the same level as the client. We have those ethical principles of like autonomy and independence and respect. And so the way we approach assessment now ethically is very different than the way that it was in the 1920s, as it should be. And then we've had different lawsuits, we've had different legal issues that have come up that have really defined how we look at, how we administer, and how we interpret testing for different groups of individuals, which we'll talk about in a later chapter as well. So there's, throughout the history of testing, these really strong connections between trends in development of assessments, development of tests, how they were normed, how they were created, and then the political and legal and societal environment in which all of those things were created and changed and adapted. So we see lots of connections between political movements, so thinking about things like standardized testing in schools, all of that grew out of a political movement. So the original purpose of standardized testing in schools was actually to prove that the USA was stronger than any of the other world superpowers by being able to essentially test our students and prove that we're smarter. So, I mean, the whole standardized testing in schools movement grew out of this need to establish the US as a dominant presence in world politics. And I can link some pretty interesting articles for you in our course page about that if you're interested to learn more about the history of standardized testing in schools. But lots of world events, educational movements, as we'll talk about as we get into specific assessments. And then, of course, our understanding of mental health. So as we've had different iterations of the DSM and different changes in the ways that we label and diagnose mental health and mental illness, we've seen a lot of changes in testing as well. So to wrap up this chapter, we'll talk about some considerations of testing, and your book calls these controversies of testing. But just things that we have to consider and think about and address in the way that we use assessments. And I think while these things are important considerations, to call them controversies, to me, like, they're not going to go anywhere. So they're just things that we have to address so that we can do assessment in a way that's ethical. And so we have to address the privacy of clients, and there are some that might say that testing is an invasion of that privacy. But if we're using informed consent processes and we're behaving and using our ethical codes, then that privacy issue should be addressed and the client should understand the purpose of the assessment in the first place. There is a comment about too much reliance on test scores for decision making. But if we're appropriately using assessment, then we're also using those observations in those interviews and not just relying on testing to make clinical decisions. Cultural bias, which is very real. So it's important to be aware of how assessments are normed. We will talk about this throughout this class. And just understand when we're looking at using a certain test with a certain client to understand if that's going to be appropriate for them and how to put that in correct context for that client. There is a limited view of some constructs, for example, intelligent or achievement testing. There's a lot of current literature and conversation around this idea of how do we measure intelligence. Intelligence is more than just math and reading scores. There are some different intelligent testing options now that include things like spatial reasoning and music and logic and different kinds of other intelligence that were not previously measured. But when you get into things like what school districts require you to use, that's where this becomes probably a bigger issue. And then in terms of achievement testing, there's conversations around this idea of measurement of education. So achievement versus growth, and which is a better picture of how a student is developing. One snapshot picture from something like an SAT, something like a standardized test, or is there perhaps a better way to measure the growth of a student in their own developmental context over time, which is what we're starting to see more of in the literature around education. And again, that's where that starts connecting back to those political movements and different kinds of things like Common Core and curriculum standards that are being developed. So there's this big conversation right now about how do we accurately assess student learning and growth and development. And then this whole concept of testing anxiety, which connects back to that achievement idea. And so because there's so much high stakes testing, which we will talk about in a later chapter, we now have created this sense of anxiety around assessment, when really assessment should just be a way to gather information. And so while the assessments themselves, they exist, they have their purpose, they're meant to be used in the way they're meant to be used, it's the context and, again, connection to these societal systemic pieces that create some of the considerations and issues around assessment as we know it today.